And
I think, can you hear him?
call to order the public protection meeting. Very good. Thank you, Janet and Kathy. Everybody's present for purposes of the roll call, and could consider the approval of our previous meeting's minutes of March 6th. Would we have any objections or corrections to make to that? Seeing none, they're approved. Is there any public comment today? Any public comment? Seeing no public comment, we'll move directly to our business items, and we'll call on the County Administrator, Ken Witt, for the financial report. And I'd also ask Ken if he would also spend a little time after his formal financial report, which, as we know, usually takes about 2 minutes unless we have some questions, if he could cover the first half dozen or so items that we're going to be considering in our next meeting of the COTW. And because of the way they're all scheduled, they deal with the items under the jurisdiction of this committee. So we'll get a little heads up as to what we're going to be hearing at the COTW, just in case we have some additional questions or want to ask Ken anything before that meeting, or for whatever other reason. Okay, Mr. Witt.
The financial report in the packet represents February. Are there any questions? All right, we'll move on then. All right. What we will talk about is I'll stop on each of the different cost centers we have, each of the departments, and talk about where they finished 2024 and then what their requests are going to be for 2026. So on the circuit court, you jump down to the bottom. As long as the number is still black, and that second column of numbers, they're good. They finished in the black, which means they had more revenues than expenses, and part of the revenues are property taxes. For the circuit court, they will be asking today for a full-time law clerk position. So that's a new position. That's not something they currently have, but it would assist the judges and the judicial system to be more efficient. We get down to clerk of courts, and Christie's not here, probably because there's a big red number, 152,000. So they were way over on several items. If you come back up and look, even this is the first two columns of the 2 prior years. So legal services, these are actual numbers over the last 2 years, 191, 232. We've only budgeted 170,000 for them for this year. So you can see they've been greatly exceeding that amount. The same with court-appointed counsel and interpreter services. Those 3 right there are really the leading cause of it. So legal services.
Ken, we have a quick question from Supervisor Leaf.
So the legal services, would this new law clerk help bring that down, or can you tell me why it's so over? The court-appointed counsel is a separate line, so it's not what I thought it would be, so.
Yeah, legal services are like guardian ad litems, whereas the court-appointed counsel is somebody that doesn't qualify for a public attorney, but still has to have an attorney representing them. We will find one for them and appoint one, and we try to collect that back, but a lot of times these people don't have the greatest financial means to repay that. So the bill, we get stuck with the bill on those. There is a line item up in the revenues. Part of the court fees and cost, it goes into this, there's other things that go into it, but part of the court fees and cost, you can see that they are over budget also. That's recouping some of those legal fees. Because we'll put a state tax lien out and different mechanisms in order to be able to recoup some of those legal costs. So we do recoup those, and you'll see additional revenues coming in. But the upfront cost is ours, and that's where that is. That's what that's coming in. And then the last one there was interpreter services. You can see we budgeted $25,000. It was $31 the year before, a little bit over, and then last year was $73,000 in interpreter services. And Christy would know more of the specifics, but I think that included well over 20 languages. So it's just, it's not all Spanish interpreting. It is a vast array of languages that we end up seeing in our court system. And so finding those interpreters can be difficult.
Ken, this may not be a fair question for you, maybe it should be for Christie, but, and she'll be joining us for the COGW. by the
will,
way. She
yeah.
contacted me, couldn't make this morning's meeting, but will be at the 9 o'clock. I know they're doing some creative things to try to bring down those interpreter costs with perhaps some new technology that's available out there. Would you have any knowledge about that, or should we ask Christie if we had that question?
Yeah, well, you get different answers. I've been pushing the technology on her. But the state court system doesn't allow technology to replace in-court interpreters. So the in-court interpreters have to be a person, and they have to be state certified. The state won't contribute towards the cost unless they're state certified. And it's very difficult to become state certified. There's a oral test and a written test, and it's not an easy thing to pass. And so especially when you start dealing with all the different languages, there just are not any state certified languages. So that's contributing to some of the costs, which contributes to that amount. Now, the good news on the clerk of courts is they have no new requests for 2026, probably just enough money to cover their escalating inflationary items. All right. We'll get to the medical examiner. So you can see a big red number for the medical examiner for 2024. That's how come we have a new medical examiner, right? No, that's not the reason, but the new medical examiner won't have that. The only thing on that that contributed to that was basically a prior period correction on retirement benefits. We had been recording something incorrectly for a number of years. So we had a prior period correction to fix that, and that contributed to that negative amount for 2024. It's right here. It's in the net wages and fringe benefits. You can see we went from $16,000 to $117,000 because basically there was about a $100,000 prior period correction. So on the medical examiner then, they have two requests. One is a very small request. It's a second striker system for their transport van. I think that's under $5,000. I didn't even list that out for a budget priority when we get to later. The other item is 2 full-time investigators that our new medical examiner, Tina, will gladly explain to you guys at the next meeting. But that would carry a price tag of probably about $160,000. We'll move on to Justice Services. So they were a new department a few years ago. I think this will be the first year now that they've finished in the black. So we finally stabilized or at least figured out exactly what their expenses are going to be. So going forward, I would expect them to be fairly consistent along their budget lines. And for 2026, they won't have any new requests.
Ken, could I ask a quick question of you on that one? If Phil wants to jump in, he can certainly do so. I know I'm just going to characterize that we've had a very successful treatment court over the years. But as a result of changes in the state law, the numbers of people serviced by the treatment court have gone down. And so now we've continued to give it a very substantial effort from the county in terms of staffing and expense and that sort of thing. And I know there's a number of options that have been looked at. But would either you or Phil care to just comment on the status of that, where we might be going on that? I know a lot of things are up in the air at this point, but just give us a preliminary thought as to what might be happening there.
Yeah, well, our treatment court numbers are down right now. And what I encourage all department heads to do is to evaluate their staffing and reallocation of resources. So as there different programs of work that they can evaluate to utilize that staff in to become more efficient in a different area. And so that's probably what we're going to do if the treatment court numbers don't come back up. So I think those are the two paths that we would look towards, and Phil can probably add more to that.
Yeah, I can just add a little bit more. And we have done what the administrator has said. We've reallocated our treatment court case manager. About 25% of her time currently is being spent in the diversion program, doing some case management while they have somebody who's on medical leave. I don't know if that will continue, but that's what we've been doing. I do expect our numbers for treatment court to stabilize. I think 8 participants is currently what we have. We have a few referrals in the hopper. I'll just say I think kind of our new normal for participants is probably in the 12 to 15 range. In the last 3 years, I don't know that we've had any more than 17 or 18. It has been down, as low as 6 or 7. So, historically, going back 5 years, 20 to 25 were more of our numbers. But as Chair Fiedler indicated, changes to state legislation, had us eliminate a group of individuals, multiple OWI folks, that we can't service them anymore. Those individuals are now facing prison sentence, and so they wouldn't come to our program. So we have just, pivoted in the resources that we have, some of the court navigation work that we're doing, our case managers are helping out with. So that's our plan, is just to reallocate our resources.
All right, moving on to the district attorney's office. When you jump to the bottom, they finished in the black for 2024. The district attorney will be asking for a full-time or an additional full-time diversion program case management specialist. They currently have basically 2.5 people working on diversion currently. Get to child support. So they had a negative 38,000. I think as of the printing of this, they were still missing one of their grants from coming in. So they promised me they won't finish in the red. They'll be in the black when the books are finally reconciled by the auditors. Their request, they don't have anything in their 2026 budget priorities that will have a significant financial impact. We get to the sheriff's office. They're broken into multiple cost centers. The first cost center, law enforcement. This is basically your patrol and investigation. If we jump down to the bottom of that and look, 462,000 in the black. Last year's that finished 385 in the red, that was when we added deputies mid-year, and so we used fund balance. So the fund balance is the negative number. That's how you use fund balance. You spend more than you bring in. So 2024 finished in the black because they had more positions added, and really it's just vacancies. Trying to get to full staff takes a while, and when you're not at full staff but you're budgeted for full staff, you end up saving money. So that's what I would probably attribute most of that to. That and some additional law enforcement fees are probably contributed to that also. For 2026, all of the sheriff's departments, we'll go through the rest of their cost centers, but they don't have anything significant in their request for operating expenses. Are you raising your hand there, Phil? No. I thought maybe you wanted to comment on the sheriff's staffing or something. All right, corrections. So that's the jail. When we scroll to the bottom of there, they finished 243,000 in the black. They have staffing also issues, trying to keep full staff. So again, when you have vacancies, you end up having some savings. So that's what I would attribute most of that to. You want to jump in, Sheriff?
Only because we're on the corrections budget component, I would like to answer a question that Supervisor Carlson asked me last month on the jail project and how much that cost. The total ended up being $558,000. Of that, $443,000 was out of the KIP, and $115,000 was out of the jail improvement fund that bricks and mortar through funding from citations. So to answer that question, I thought this was about the only spot I could answer that with the agenda items. So thank you.
Moving into emergency management then. So they finished 93,000 in the red. and that is state general government grants. They haven't received that. You getting that money yet, Janet? You're just not getting that money. Huh, all right. We'll have a chat later then. For 2026, they don't have any new requests there. But they won't be spending that grant money in the future then. You've reduced your expenses to accommodate not getting that grant. Yeah. All right, then emergency communications, Terry Anderson's department. Everybody loves Terry. He finished in the black. Good job, Terry. And they don't have any new requests for 2026. They built some more dispatch councils, so I was afraid they were going to ask for more dispatchers right away, but not yet, I guess. And that was it for all of the departments that report to public protection.
Do we have any questions for the administrator about that? We'll hear a lot of this again in half an hour, but it is good prep before we do that, in case we had any things we need more discussion on. Supervisor Ramberg.
Thank you, Mr. Chair. Getting back to that prior year adjustment you were talking about, so is there another area that was credited for that then, if it was a flip-flop?
No, I mean, I'll explain it. So you qualify for Wisconsin retirement system based upon the number of hours that you work. I mean, that's the qualification. So it used to be 600 hours, now it's 1,200 hours. They changed that in 2011. Basically, though, with the medical examiner, at some point she crossed that threshold. So it wasn't caught, though, until she went into file for her retirement, and she sort of talked it over with them, and they go, well, we think you probably should have been put in sooner. So we went back, we pulled all the records, did a detailed analysis, and I think we determined our best guess is probably 2015 is when she crossed the threshold. So we had to back pay those years of retirement contributions, to the state.
So it was the state that, So it was the state of Wisconsin, WRF, that received the
Yes.
funds.
Yep, that's who we paid it to. Yeah. So, and that was our portion of that.
Seeing no other questions, we'll go to the last item on the business agenda and welcome Tina Forrest, our new medical examiner. Welcome, Tina. We got to meet you just briefly at the last meeting, but this will give you just a little bit of a chance. I know you've been on the job all of 2 days, so we look forward to hearing from you, and it's all yours.
Thank you. 2 long days so far. Bit overwhelming, but we're getting our feet wet. So basically what I wanted to update, it's a lot of, I'm going to echo Patty quite a bit. She was in the job for a long time. She understood the department, she understood the needs, and she understands the growing needs. So I'm just going to kind of echo that a little bit. I have a lot of the same thoughts as she did. So I'm just going to start off by saying that our numbers, it's stark. We are 200 cases over our previous year, and that's including 9 additional scene investigations through March, 3 of those being homicide investigations, which is abnormal for our county. So these are it's more than just data. It's a testament to the growing strain and on our resources and our systems here in St. Croix County. Our office, law enforcement, emergency services, we're all facing exhaustion because of these facing demands. And every department feels the strain. We're stretched to our limits, and the consequences aren't just operational, they're personal, as our staff is facing burnout and increased risk for injury. And it's workplace challenges that are compounding these issues. One critical factor is the increasing weight of decedents. This has made it more difficult to move and handle individuals safely. Without proper equipment, we risk workplace injuries to our deputies who work independently once they leave the scene. When we're on scene, we have immense help from law enforcement, and I need to give kudos to them because I know what it's like to not have that help from previous jobs. They've always been wonderful in assisting. But after we leave that scene, it's just us, just one person. I am a very little human. So when I get back to the office, if I have a 300-pound individual that I have to try to move around and maneuver using old equipment and basic funeral cots, that forces me to contact for lift assist for fire department, which puts strain on them, especially when I have to contact them at 3 o'clock in the morning, which I had to do, I think, 2 Fridays ago. And that's just simply to help me get the cot out and then get that individual moved over. I would rather us be safe with a striker cot that's automated and possibly an overhead lift, something that would help us handle that weight instead of just pulling. Additionally, there is a rise in biohazards during investigations, which is unfortunate, but it happens. And this has created a pressing need for safe and efficient disposal to protect everybody involved. So what I'm speaking with there is the disposal of saturated clothing. Currently, the medical examiner's office in New Richmond does not contract with a biohazard removal. So if we're wanting to follow the correct policies and procedures, we should have the red biohazard bags that these are going into, and they should be being picked up by a biohazard company as opposed to just being disposed of in a dumpster. So that's an immediate need. And then in addition, maintaining accuracy and quality control. So we have this new RANDOC system, which is amazing and cost effective. When you're running a RANDOX, it takes certain additives in the blood tubes to keep that blood from hemolysis, right? So from breaking down. You want that blood to remain so that you get a more accurate test. We did have an issue, I think a couple months ago, where our RANDOX technician was receiving false positives. And they weren't sure at first if they were false positives. They did research and found out it was because our blood tubes that were purchased did not have an additive in them. Blood tubes are not cheap. Normally we get some from NMS, who we send our toxicology out to, but now because we have the RANDOX, we don't need to send nearly as much to NMS. So that partnership of receiving those free blood tubes is starting to dwindle a little bit there. So those are the main hitters that I want to talk to you guys about today. And I feel like we have to address these proactively. We need investment in modernized equipment for biohazard disposal, measures that ensure the health and safety of our staff. And I think together we can create solutions to safeguard the integrity of our work while protecting the well-being of the people who make it possible. Our department will continue to work as effectively and as efficiently as possible to serve the residents here in St. Croix County. But let's not just adapt, let's act. This is about protecting the well-being of our staff, ensuring public safety, and upholding the integrity of our work. Together, we must invest in resources and solutions that meet these pressing challenges head-on. And that's all I have. Thank you.
Thank you very much. Tina, questions for our medical examiner? Supervisor Lee.
Couple. I'm assuming that the costs for the biohazard and the striker cot are in the request for budget, or is this a separate item that we need immediately?
The striker cot is in the cost for the budget for 2026. The blood tubes are not on there. This is something that was brought to my attention recently while I was interviewing for a program coordinator position. And this individual also, Brooke, she's a deputy with us. She's a data nerd and a science nerd. So she's been running our Randox testing. And she was the one that discovered those errors and ended up having to rerun 5 or 6 tests to determine what the actual qualifications were.
And then the biohazard bit too. So I saw Ken was going to his mic, so I don't know what is the cost of that, the biohazard bags and all that?
That I haven't researched
Okay.
yet.
But it's just something that you
Yeah,
know
this
that you
is
need.
just something that we're looking into.
And I think the striker cot, I looked those up, I think they were under 5,000.
Yeah, I believe for a used one, and it depends on whether you want an automated one that's battery operated. So all you got to do is push a button. That's what we currently have, which is extremely nice. We also, the striker cot is in our really large transport van, so we had to get the track system, to pick it up and put it back in. This striker cot, the second one that we're requesting, would not require that track. It would just go in our smaller transport van, so there wouldn't be an issue lifting it to get in. So it would be much cheaper than our current system in the larger transport van.
And then you mentioned a lift, like, is that would be a separate issue than
Yes,
the striker
that
cot?
would be a separate issue, yes.
Supervisor Ramberg.
Thank you, Mr. Chair, and that's exactly where I was going with the lift or any of those higher cost items would probably be a capital improvement plan issue to vie for position in that, depending on the cost.
There's different routes that we can take. The overhead lift would be an expense, a major expense. There's also modified lift systems that are much cheaper, that work just as well. And it's basically a modified forklift that has straps. I think they're weighted for like up to 1,000 pounds. And you just slip the straps underneath them, and then it's manual, so I get to work on my biceps, and just crank, and it just lifts them up, and you can slide out the cot and slide in the table. So that one's much more cost-effective, and it's very user-friendly.
Yeah, if it's above 5,000, it'd be a capital improvement item, and below 5,000, it's just an operating expense. And Tina's only been on for a couple days, so she hasn't learned all my magic tricks yet. See, nothing up my sleeve, but she can go buy the cot now.
I have 2 quick questions. One, they're both very general ones. One for you and one for the committee. One for you is, you mentioned we are at least plus 200 already this year. So we're headed toward a massive number of increases in deaths in St. Croix County that will be coming through your office. What would you estimate that to be, something around the figure 1,200 to 1,400 this year?
Very possible, and that is only going to expand in the coming years with our increasing aging population, which I know Patty has spoken about quite a few times, and I absolutely echo that. We're not seers. I'm not. I'm not a psychic, but if you look at trends and pull the data from the population. And given the baby boomers are reaching the senior ages now, add in cuts to Medicaid, Medicare, a lot of these individuals can't afford to live in assisted living facilities, so they're forced to reside at home or with, a caretaker, and that would warrant a scene response from our office. So it's going to greatly impact our caseload.
And looking toward the future for capital expenses, I'm suspecting pretty soon we're going to hear about, although we've added to this substantially in recent years, probably we'll need to add to refrigeration capacity.
Absolutely.
And also perhaps with the increase in cremations, we might need to really consider whether we have the capacity to handle the cremations in the county. Is that basically a true statement?
Yeah, the out-of-state cremations that are coming in, it's hard to keep up with, to be honest. I think I've signed 15 in the last 2 days of out-of-state cremations, which it's simplified, but, at the end of the day, it's my name on that document. So I need to be sure that everything is proper. So it does take a little bit of investigation into each of these to make sure that I'm not accidentally cremating a homicide, where I could possibly get myself in deep water.
And given the limited capacity we have with those coming in from out of state and the higher numbers that are coming in, I would imagine there's going to be possibly a real press for timely services.
Absolutely.
And then the question I have for the committee is this, and I've talked to Tina about this, and she's already said yes to this question, but I said we'd raise it with the committee. We have on occasion, maybe every other year, tried to visit some of the offices or entities that we have jurisdiction over. So the thought is that we might care to visit the medical examiner's office, and it would be an official meeting of the committee, and we probably would only schedule that. There would be nothing else on the agenda for that month. I said we'd work with Tina for a time that was convenient for her and convenient for us. So I'm not suggesting at this point a time, but we can chat and see if a time works for us. Perhaps to give Tina maybe just a little time, we're thinking maybe, well, at least a month, at least beyond a month.
Give her more of
Yes,
a day.
exactly, exactly. So does that sound like something we would like to do? It's obvious up at New Ridge. Okay, I think everybody would concur with that. So Tina, we'll just work together on that, and we'll work with everybody to find a convenient time to do that.
Perfect.
And so I believe with that, if there's no other questions for Tina, did you have any further comments to make, Tina?
Nope.
Thank you very much for being with us today, and good luck in the job. It's a very, very important one, and we appreciate what Patty did and all the issues that you face. With that, request for future agenda items? Seeing none, we'll move to announcements. No announcements. And our date of our next meeting will be May 1st. And it's very likely that I will not be in town on May 1st, so I'll ask our Vice Chair to plan on chairing that meeting, if that's okay. Yep. And with that, we're adjourned. Thank you very much.
You're not going to be here on